Yeah, so it's a bit of a nasty question, right? So P53 mutations we know across the board are bad. Certainly in myeloid malignancies, MDS, AML, very challenging, chemo-resistant, certainly convey a risk of progression to AML. I think within MPNs, we're lucky because most patients don't have P53 mutations, and in those that do, we know it's a high-risk player, but we're not exactly sure what to do with it in all cases. And I think, we certainly are limited across the board in what we can do. I think many times we are screening these patients for P53 mutations because we're doing broad sequencing on at least most of our MF patients. Increasingly, we're doing it on PV and ET patients to look for high-risk mutations. But then what do you do with it when you find them? And I think that's something that's challenging, especially for diseases that otherwise have a very good prognosis in terms of years of life lived, to say, oh, you have a great prognosis from your ET, but you have this low-level P53 mutation that may convey an increased risk of progression to acute leukemia, and I'm not sure if intervening now is going to change that. I think it's just a challenging position to be in. We certainly do that with our patients. We spend a lot of time counseling when we do see these P53 mutations, but it's one of those things where I'm not sure if we know exactly what to do with it now.